drains the thoracic wall and the upper lumbar region. It's an important channel connecting the superior and the inferior vena cava. The term azygos means unpaired. The vein occupies the upper part of the posterior abdominal wall and the posterior mediastinum. It also connects the portal venous system, the caval venous systems, and the vertebral venous systems. How is it formed? The azygos vein is formed by the union of the lumbar azygos, the right subcostal, and the right ascending lumbar veins. The lumbar azygos vein may be regarded as the abdominal part of the azygos vein. It lies to the right of the lumbar vertebra. The lower end communicates with the inferior vena cava. The right subcostal vein accompanies the corresponding artery. The ascending lumbar vein is formed by the vertical anastomosis that connects the lumbar veins. The azygos vein may be formed by the union of the right subcostal and the ascending lumbar veins. Course: the azygos vein enters the thorax by passing through the aortic opening in the diaphragm. The azygos vein then ascends up to the fourth thoracic vertebra, where it arches forwards over the root of the right lung and ends by joining the posterior aspect of the superior vena cava before it pierces the pericardium. Relations: anteriorly, so the azygos vein, anteriorly we have the esophagus, posteriorly we have the lower 8 thoracic vertebrae and the right posterior intercostal arteries. To the right is the right lung in pleura and the greater splanchnic nerve. To the left, we have the thoracic duct, the aorta in the lower part, esophagus, trachea, and vega in the upper part. Now, tributaries of the azygos vein. Firstly, the right superior intercostal vein formed by the union of the second, third, and fourth posterior intercostal vein, then 5th to 11th posterior intercostal veins, then hemiazygos vein at the level of the lower border of the 8th thoracic vertebra, the accessory hemiazygos vein at the level of the upper border of the 8th thoracic vertebra, the right bronchial vein near the terminal end of the azygos vein, several esophageal, mediastinal, pericardial veins. Now, coming to the hemiazygos vein. Hemiazygos vein is also called the inferior hemiazygos vein. It is a mirror image of the lower part of the azygos vein. The hemiazygos vein is formed by the union of the left lumbar azygos, left ascending lumbar, and the left subcostal. Course: the hemiazygos vein pierces the left crux of the diaphragm, ascends on the left side of the vertebra overlapped by the aorta. At the level of the 8th thoracic vertebra, it turns towards the right side, passes behind the esophagus and the thoracic duct, and joins the azygos vein. Tributaries: 9th to 11th left posterior intercostal veins and the esophageal veins. The accessory hemiazygos vein. The accessory hemiazygos vein is also called the superior hemiazygos vein and is a mirror image of the upper part of the azygos vein. Now, to see the course, the accessory hemiazygos vein begins at the medial end of 4th to 5th intercostal space, descends on the left side of the vertebral column at the level of the 8th thoracic vertebra, turns to the right, passes behind the aorta and the thoracic duct, and joins the azygos vein. Tributaries: 5th to 8th left posterior intercostal vein, sometimes the left bronchial veins as well. Now, very important, thoracic sympathetic trunk. Features: the thoracic sympathetic trunk is a ganglionetic chain, one on each side of the thoracic vertebral column, superiorly continuous with the cervical part of the chain and inferiorly with the lumbar. Theoretically, the chain bears 12 ganglia corresponding to the 12 thoracic nerves. The first thoracic ganglion is commonly fused with the inferior cervical ganglion to form the cervicothoracic or the stellate ganglion. The remaining thoracic ganglia lie at the level of the corresponding intervertebral disc and the intercostal nerves. The course and relations. The chain crosses the neck of the first rib, the heads of the second to 10th rib, the bodies of the 11th to 12th thoracic vertebrae. The whole chain descends in front of the posterior intercostal vessels and the intercostal nerves, passes deep to the medial arcuate ligament to become continuous with the lumbar part of the sympathetic chain. The lateral branches for the limbs and the body wall. Each ganglion is connected via its corresponding spinal nerve by two rami, the white, that is the preganglionic, and the grey, that is the postganglionic rami communicantis. The white ramus is distal to the grey ramus. The grey rami communicates along the spinal nerves to supply structures in the skin and the blood vessels of the skeletal muscles of the whole body. Medial branches to the viscera. The medial branches from the upper five ganglia are postganglionic and get distributed to the heart, the great vessels, the lungs, and the esophagus through the following: the pulmonary branches to the pulmonary plexus, cardiac branches to the deep cardiac plexus, aortic branch to the thoracic aortic plexus, and the esophageal branch to the esophageal plexus. The medial branches from the lower seven ganglia are preganglionic and form the three splanchnic nerves. The great splanchnic nerve is formed by five roots from ganglia 5 to 9, descends obliquely onto the vertebral body, pierces the crux of the diaphragm, and ends in the abdomen, mainly the celiac ganglion, okay, and partly in the aorticorenal ganglion and the suprarenal ganglion. The lesser splanchnic nerve is formed by two roots from ganglia 10 and 11. Its course is similar to that of the great splanchnic nerve. It pierces the crux of the diaphragm and ends in the celiac ganglion. The least or the lowest splanchnic nerve is extremely tiny. It is a renal nerve arising from one root from the ganglion, piercing the corresponding crux of the diaphragm. Now, cardiac pain is basically ischemic, caused by incomplete obstruction to the coronary arteries. The axons of these pain fibers, conveyed by the sensory sympathetic cardiac nerves, reach thoracic 1 to thoracic 5 segments of spinal cord, mostly through the dorsal root ganglia of the left side. Since these dorsal root ganglia also receive sensory impulses from the medial side of the arm, forearm, and upper part of the front of chest, the pain gets referred. Through the pain is usually referred to the left side. It may even be referred to the right arm, jaw, epigastrium, or the back.